Morning. Morning.
Tariq is dead. He killed himself. I'm sorry.
What just happened? While we never know why, how, or when mental disorders truly starts, left untreated, we know how it ends. It ends with suicide, and the number tells it all. In 2015, the Healthy Campus Initiative report in University of Malaya found that depression, anxiety, and stress were prevalent among undergraduates and anxiety highest among the other two symptoms. Level of depression, anxiety, and stress of moderate to severe symptoms highlight the need for further assessment and need for action by the university and health professional. All of these concerted efforts is to mitigate one issue, and the issue of mental health stigma.
The framework that our group is proposing to address that most worrying situation is the whole organization approach. What is it? It's a reconfiguration of universities' cultures as health-promoting and supportive environments, in addition to their core missions of learning, research, and social and economic value creation. A whole organizational approach has 4 domains: empowering the student population to understand the importance of well-being and good mental health, develop skills and resilience to keep well, understand the signs of being unwell, and be confident to ask for help. Fostering connectedness amongst learning communities, enhance rapport with the academic staff, support, facilitate, and improve healthy cultures within the social, physical, and digital environments that students live in, and finally, develop and resource a range of services appropriate to the needs of the students and link them effectively with academic policies.
So the objectives of our program are: number 1, to build resilience among the university students to cope better with their university life. 2, to promote good mental health among the university students by recognizing signs of mental health disorders among peers. Number 3 is to mitigate the consequences of mental health stigma. And lastly is to embed a sustainable and resource approach focusing at the upstream of the institution. Our target population is the university freshmen, as they are at their most vulnerable mental state, making this transition into independent living.
We believe that it is very important to have a continuous program. This will help the university to build a resilient program, especially to address anything to do with mental health and stigma per se. We have planned to give a theme-based program to these activities, namely, at least for example, giving 6 cluster-based programs. It is important for all these activities and clusters or themes be interesting for our students and encourage active participation for our university students. Themes such as Embrace the Journey could include activities such as a candlelight vigil that would actually talk about mental health awareness to our students. Or maybe you could have themes like why mental health is important to me. Here maybe we could have activities such as poster competitions, or even hashtag messages in Instagram that will actually spread the message to all our university students. More other activities such as movie nights or even book reading events are innovative and creative activities that can be sequenced for active participation. At the end of the day, it is important for us to deliver activities that are sequenced, active, focused, and explicit for our young adults in the university. Because if we would want to reduce mental health stigma, it has to be a holistic program, it has to be an integrated program to our young adults in universities.
So how do we do it?
how do we ensure a successful implementation of a whole organization approach to mental health stigma in university? It begins with university adopting mental health as a strategic imperative, an institutionalized commitment to look after their own community of students and staff, to support them through mental health difficulties and to help them to thrive and succeed. So to do this, it is critical for the program to be helmed by a member of university governing the board, such as a VC. This will ensure sustained resources and support, as well as a buy-in and accountability from the top management. Resources such as provision of counseling services by the social work faculty through an allotment of counseling hours, and an in-house protocol to ensure an access for support and care for those who need it, such as a referral system, a policy to include mental health education and awareness as a component in the orientation pack for new students, training for the residential houses leaders to understand and remain sensitive to an emerging mental health concern amongst their charges. With this, sustainability can be achieved, with the project management handed over to the university staff and student body after the first year, and to ensure that the project is embedded in the university psyche.
Right, so the program evaluation consists of three major aspects: process evaluation, outcome evaluation, and impact evaluation of the program itself. The process evaluation will examine whether the program is conducted as intended, looking into the resources, activities, and the participation of our target population. The outcome evaluation, on the other hand, will focus on whether the objectives are achieved, looking into knowledge, attitude, and practice of maintaining good mental health among university students. And the impact evaluation will look into whether the goal has been achieved in reducing the stigma of mental health among students by looking into the trend of students who seek help for mental health issues, as well as trend of cases that reflect serious mental health management among students, such as self-harm activities and even suicide rates. Multi-pronged approaches combining both quantitative and qualitative studies using various tools and identify key indicators will be necessary to perform the program evaluation. In our proposed budget allocation, the financial resources are focused on three major areas: module development, module delivery, and evaluation. The main bulk of the budget will be allocated to the running of the module, with an estimation of $20,000 needed in the span of 2 years. Next, an estimation of $12,000 will be allocated to evaluation process, and $8,000 will be allocated for module development and refinement throughout the 2-year period, giving a grand total of $40,000 in this 2-year program.
We will use the SWOT analysis to assess the feasibility of our program. In terms of the strength of our proposed health program, it will increase student retention and enhances academic performance. Secondly, our health program will be based on evidence-based methodology. And thirdly, this health program will also be addressing issues of mental health and stigma at both upstream and downstream. In terms of the weaknesses of our health program, firstly, our health program will be limited with budgetary constraints. Our health program will also require a whole university commitment and multi-agency collaboration, which may be challenging to be achieved feasibility and in terms of implementation. In terms of opportunity, the health program will be adaptable and adoptable to other universities and institutional organizations across Malaysia. Secondly, the health program will have opportunity to gain wider community interest and political traction towards issues of mental health among our university students. Finally, threats towards our health program will be in addressing culturally ingrained taboo to talk about and discuss about mental disorders that may become a significant barrier. Subsequently, lack of sustained and continued funding which threatens suitability and continuity of our health program.
So in conclusion, the program is designed based on a robust and established health promotional model, which is the whole organizational approach. Hence, the mechanisms of assessment, implementation, and evaluation for the program in a holistic manner are actually in place. The success of the program depends on strategic partnership and leverage on strategic partners' resources. The feasibility of running the program lies on its structure that is flexible and adaptable to the resources available. Ultimately, the program has good sustainable strategies and has the potential of producing significant impact to the community and the target population, and worth considering to be introduced and implemented.